Massage guns. Pretty much all my patients have them, it seems, with house calls, and I use this every day on my patients. There's a bunch of different brands. This is more of a higher end brand. I really do feel like you get what you pay for with the massage gun. When you hold this hypervolt, it feels expensive, right? And it's much more powerful than some of the cheaper ones I've worked with, or my patients have, I suppose. Now, when I use this, I typically opt for a bit that's a little more rounded like this. It's got more surface area. And the reason I like that is because I feel like it allows me to get deeper into the soft tissue without really, being or causing any discomfort, right? The other thing with using one of these is you want to make sure you're using it over soft tissue. When I've seen people use it, they tend to go straight on into certain areas, and then it turns into more of a jackhammer than a massage gun because you're getting over the bony structures. So you want to make sure you're on the soft tissue. One thing I do is I generally come in at an angle. I don't come directly onto the muscle. I come in at an angle, all right? Now, this is good for increasing blood flow to the area. So it's good with recovery after a workout, or it's good if you're sore. It's going to help with recovery because of the increased blood flow. Now, you might experience some deep itchy sensation. Again, that's the blood flow coming into the fascia there, okay? That's normal. You might not. The other thing it's doing is that vibration is interrupting that signal from the brain to the area that's sore, and it's just blocking that signal. How long do I usually use this? I mean, you don't use this for maybe 5 or 10 minutes. This isn't, a 45-minute massage. You're going to probably burn this thing out. Nothing's going to replace a good manual therapist. This is simply an aid, okay? So, quick rehash of everything. I typically like using the bigger bits because of the surface area. Make sure you're staying onto the soft tissue. Don't go over directly onto a bone or even directly onto the muscle. I think an angle is best. And then the other thing that I have here, this does have a lot of soft surface area. I like using this for myself. This also vibrates. I don't know if you can tell. And then I usually use this on my back. I'll put it on the ground, pin down an area that's sore, and kind of work that out, kind of like a foam roller. So I hope that helps. I hope that makes sense, and we'll see you in the next video. Have a great day. Bye.